Welcome, everyone. I see I have people waiting for this class, and this is the class that if you are a nurse in Kenya, in Ghana, in Nigeria, in Ethiopia, anywhere in the African diaspora, let me know where you're from because we are doing something special just for you. And let me tell you, if you have ever been considering taking the NCLEX, now is the time to do it. We're going to be talking today in my class about NCLEX, the changes. You may have heard that a new test plan is coming out. And also, I'm giving you two promises today. The first promise is that you will absolutely know what you should be studying for NCLEX. The second promise is that finally you will have a path to get to my home country, the United States of America. So I want to welcome every ReMar nurse here. This is indeed your time. We are going to be diving in today. Okay. We're going to be diving in today the NCLEX. My name is Professor Regina Callion. I am the number one NCLEX instructor on this planet. And that's because I have the number one nurses. I have the number one nurses in our community. I don't know if you knew this. Maybe this is your first time joining me, and more of you will be coming in. I have an amazing partnership with KenyanNurse Consultants, and we have collaborated to do this. It's a unique, once in a lifetime thing that you see happening where we are empowering African nurses to take control of their US nursing journey, meaning you don't have to wait for a company. You don't have to wait for somebody to tell you what to do. You don't have to wait for somebody to process your paperwork when they decide to do it. I mean, so many good things, but we are seeing that nurses are achieving that USRN, achieving their American dream. And I am not doing it by myself. I will be introducing my partner, fellow nurse, right? One of us, fellow nurse, Paul Simi, you are in today. But let me highlight, happy Sunday, everyone. Let me highlight the growth that has been taking place. And you may have seen it if you follow me on TikTok, if you follow me on LinkedIn, if you follow me on Instagram. Look at the work that's being done. I'm going to make this big so everybody can see the partnership training. If you see your school, shout it out. If you don't see your school, Houston, we have a problem. I want you to put your school in the chat so that we can know that we have a ReMar nurse from this institution. But we have Uzima University. We have Clark International University. These are now authorized NCLEX training, and they're using ReMar products to make success guaranteed. Legacy College. Are you familiar with these? Nairobi West Hospital College, Lake Lorenzo Medical Training College. I actually was able to go there, walk those hallways. It was so exciting. Messina School of Nursing. Yes. Do you see it? Jones School of Nursing, Bafa Medical Training College. I mean, we have some amazing partnerships here. Let me show you. Nwansha, I think I might have got that right. Adventist School of Health Services, at Kaimosi Friends University. What I'm showing are all the partnerships here. Presbyterian University of East Africa is in the house. Kirinyaga University College. I'm talking about growth. I'm talking about expansion. I'm talking about bringing NCLEX resources right home. Masinda Malera University of Science and Technology. I'm keep going because we got more. We got RAM Training College, Bishop Stewart University. Check this out. Huge, 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 huge. Kenya Progressive Nurses Association. Wow. Wow, wow, wow. We are able to partnership with this huge and such a prestigious nurse association. We have North Coast Medical Training Center, College, Presbyterian College of Health Sciences, Kenyatta University, and Catherine McCauley Nursing School. Can you imagine that this kind of expansion would have taken place? And like I said, I am blown away every time I see the list growing and growing and growing. And I did not do this by myself. So right now, the person who you need to be connecting with, do not leave this live without his number. And the number is It's going across the screen at the bottom, the WhatsApp number. This is the person with the key to get going, okay? Because we know there's training, but there's also a pathway. So I'm going to introduce another nurse who is so successful in this game. His name is Paul Simi, URN. I'm going to welcome him. Welcome, Paul.
Hello, Prof. I hope you're doing well in US. I'm also doing well in the UK. As you said, I'm also a nurse who has walked the journey, and I have the experience of the journey as a candidate and as a nurse who's always walked side by side with nurses who've dared to dream, who've looked forward to achieve their dream. So you coming to work with us has been something like a blessing in actually in all fulfillment, where we have witnessed a lot of growth in Africa. And when you came to us, that is in 2024, our dream was how can we achieve a situation where nurses are able from Africa to access the American dream with ease and without any struggle in an affordable way. And truly speaking, we've done great work since we started working together. As we speak now, we are having a lot of nursing schools that are now becoming ReMar NCLEX training site. That means they can be able to integrate the NCLEX concept, the NCLEX technologies, the NCLEX models of examination into their curriculum. They are able also to actually admit students who are nurses who are qualified to actually train NCLEX under the ReMar NCLEX training system from their home, from their school. It means you going to join a nursing school at the end of your training before you just go to sit for your national nursing council exam, you are able to be admitted in a ReMar NCLEX training school from your home school. And when you now move out of the school, you're ready to sit for your national exam, you're ready to sit for your NCLEX exam and be able to chase your dream. And together with Professor Regina, we are here to make that possible and to ensure that you do not only access the resources, but we also work with you step by step from the time you make your decision to the time you arrive in the US, when Professor Regina will be welcoming you in her home country. And I'm sure it's going to be an exciting journey. The journey has been there for some time. We can't actually lie, but for long time, people have actually scared most nurses from Africa in such a way that it looks like it's a humongous journey. But together, we are making this journey as simple, easy, and fast as possible. As you're going to see, with our partnership, we are able to actually support you become a USRN, that is a licensed nurse to practice in the US within 6 months. And that is we work with you from the first day you make your decision, the first point you make your decision, and you become a USRN in 6 months. And we are also growing so fast. With our partnership, we've managed to bring on board close to 60 nursing schools. The names will be coming on board soon. And we are also growing. We have a good presence in Kenya. We've spread to Uganda and also UK. And we are looking forward to also spread in all African countries because as we speak now, we are virtually supporting most of the nurses who are coming from all African countries. So together with ReMar NCLEX, we are reducing the period that has always been witnessed by nurses, where some agencies have been making nurses to spend close to 5 years before they even sit that exam. Forget about actually relocating. But for us, our partnership ensures that you are able to sit for your NCLEX exam within 6 months. And this is how I'm going to actually explain to you how the 6 months are going to actually look like. That's how your 6 months. For example, if you make a decision to start your process from tomorrow, that is Monday, or even today, you are going to actually be admitted straight away to ReMar NCLEX. That is the first step. You start NCLEX. Then, once you start your NCLEX, we do understand there are various other processes that are involved before you sit in the exam. Because NCLEX is not just like any other exam like IELTS that you can just walk out of your room and then you run to the exam room. No, with NCLEX, you have to be verified at various levels by various bodies. One of the body is actually CTFNS, the famous CTFNS, which is through merit. And As you continue with your NCLEX training, KenyanNurse will pick up with you and guide you through the true merit, that is the former CTFNS, where you are looking forward to get your assess report within 2 months. We're going to handle your school verification. We're going to handle your nursing council or whichever council you are registered with in whichever country. And we are going to ensure that all your paperwork are well outlined and well submitted for you to get the SES report. And you're going to be issued with this report within 2 months. You see, these 2 months, you're not sitting idle. These 2 months, you are proceeding with NCLEX training under Professor Regina. Then once you have the 2 months, you have the SES report. What are we going to do next? This is what we're going to do next. We're going to commence your nursing body registration. And in US, each state has its own individual or state kind of state board of nursing. We call them state board of nursing. So we're going to guide you which state board of nursing, why, how efficient is that state board of nursing. Then we're going to guide you on how to start the registration and the processing of that registration immediately. And with that, we are going to ensure that you have submitted every information required, documents required, and all credentials that are actually requested. In doing so, ensures that we get you to get the authorization to test within 2 months. Once you have your authorization to test, remember now you've taken how many months? You've taken 4 months. And these 4 months, as we are working hard day and night to ensure that you get all these documents, you get SES report, you get ATT, what are you doing? You are continuing with Professor Regina in the NCLEX training. So you've spent now 4 months in the NCLEX training. Now we move next. The next step, once we have your SES report, we have your ATT, we now move on to book your exam. And the body or the institution that is actually given the mandate to test or to administer the exam is Pearson VU. And luckily enough, fortunate enough, in Africa, we have 2 exam centers. One is in South Africa. The second one is in Kenya, in Nairobi, just close to our office. Actually, our office in 1st floor. The exam center is in 7th floor. It means you pass by our office as you go towards the exam. So you have your SES report in 2 months. You have your State Board of Nursing authorization to test in 2 months. Then we now ask you, are you ready? Remember, you've already spent 4 months with Professor Regina. Ultimately, you are going to be ready for this exam. Immediately, you actually give us a note that you are ready. We're going to book for you the exam. Of course, we apply through Pearson VU. Once you apply through Pearson VU, you're going to get second ATT. Once you have those 2 ATTs, you are going to be booked the exam. And at that moment, allow me to be a little bit patriotic and welcome each and every nurse from Nigeria, from Ghana, from Ethiopia, Sierra Leone, Lesotho, whichever country you are in. I wish to welcome you to Kenya, book the exam, and we shall ensure that your stay in Kenya is well taken care of and you'll enjoy the magical climate in Kenya, the magical culture. And it's not just an experience about the exam. You're going also to experience the Kenyan culture. So we shall be there for you. And that can only happen within 1 day. Your exam is booked and you're ready to come. Currently, if you're from any African country, you don't struggle with visa in Kenya. Actually, the president did some good work, and now you are able to come in without any visa, and we shall only guide you through the required process in terms of the ticket and other accommodation logistics. We do also help you with that. So that is how your process is going to look like. 2 months in your CTFNS as you are continuing with your NCLEX training under Professor Regina. Next, we move on 2 months. We are now doing your State Board of Nursing. You get your ATT. Next, we move on 2 months to Pearson VU. You get your ATT. Then 1 day, your exam is booked. You are ready to sit for the exam. That is how the process has been made easier for you. And we're doing this not only to few nurses. We are doing this close to 2,000 nurses from the time we started with Professor Regina. Many have passed. Many have become USRN, have passed NCLEX, have become USRN in actually 4 months, in 5 months, and 6 months. Now it's your time. But before we proceed, we do understand that the NCLEX updates were discussed on 10th of September, and Professor Regina was actually attending the conference from the first minute to the last minute. And she's here with us to share with us the updates so that if we are able to understand what is being changed, we are able to prepare adequately. We are able also to know that we need to book the exam as soon as possible. The more you postpone, because as things change, they always become harder. They always become complicated. They always become confusing. So why wait until when things are confusing? Come to KenyanNurse together with Professor Regina, who is going to provide the NCLEX training to you so that you become an NCLEX passer within the shortest time before those changes come into effect. We're going to hold your hand as KenyanNurse to ensure that your documentation is done perfectly until you don't get affected by the changes. Why wait for the changes when we can achieve this in 6 months? Yes, I've seen a question from a nurse who is in Cameroon. We have so many nurses in our training from Cameroon. So we do support nurses who are from Cameroon, from Nigeria, from Ghana, Ethiopia, or in short, any African country. Wherever you are, whether you're working in the UK, you're working in Saudi Arabia, Qatar, German, any country, Ireland, Malta, provided you're a nurse from Africa, we do welcome you, and we're going to ensure that you don't get hit by those changes that are coming, because you can become a USRN in 6 months. Prof. Gina, please, you can take us through those changes that were discussed. And I know you have had reservation, especially on the issue of home-based testing,
Yes.
where we do understand that we are still growing slowly in Africa in terms of technology. And if those changes are going to come so fast, we're going to be hit hard. Maybe you can take us through those changes, and we shall be really happy to hear them.
Thank you so much, Paul. And I hope that you all understand that the pathway to the US is so much easier when it only takes 6 months to get that USRN. So thanks, Paul. We'll hear from Paul later. So if you have questions for him about coming over, about what you need to do, like he said, it doesn't matter where you're from. He can assist you. Nigeria's in the house. Cameroon, we see you, and Kenya as well, always representing very well. So let's get into this, which is all right, we're going to talk about the 2025 NCLEX conference. I had such an amazing time at this conference this year. It was virtual. And so through virtual recordings and questions and answers, I was able to interact with over 1,000 other nurse educators who are preparing and training in the classroom how to prepare for NCLEX. So let's talk about some of the things that we learned about this conference. And hi, everyone. I have TikTok, I have YouTube, I have Facebook, all loaded up. So we have nurses. Let me know where you're from in TikTok as well so that we can address your concerns too. Okay, so the first thing that I want to remind everybody is when we are talking about NCLEX, we are talking about one of the most trusted licensure examinations in the world. So if you are coming to the United States to work, the first question people want to know is, have you passed your NCLEX? Nurses who pass their NCLEX are esteemed as someone who is able to critically think, someone who is able to understand the culture and the medical system in the United States. And boy, I will tell you, the NCLEX is very much a cultural exam. They actually addressed how our culture is integrated into the exam. So if you're taking the NCLEX, guess what? You better know our toys that we use. You better know the medication names. You need to understand how certain cultures behave, because this is a very diverse country. So you need to know how the Hispanic population behaves when they come into the United States. You need to know how the Asian Pacific Islanders behave. You need to know how the Arabian patients behave. So if you have your Quick Facts for NCLEX book, as I reach for mine, if you have your Quick Facts for NCLEX book, do not neglect this part of the book. And I don't really talk about this as much, but I do want to highlight it. Coming from the exam, the culture section of Quick Facts. Did you even know that this book had a cultural section? And so here are the cultures that you need to be mindful of. All right. So we have the African culture, West, East, North, Central, South. I have a lot of you here today. That's different from the African American culture. We do not behave the same. Also, Asian Americans, Caribbeans, Filipino nurses, Haitian nurses. Haitian nurses are different from the rest of the Caribbean. All right. Indians, South Indians, Buddhists, Jehovah Witness, Muslims, right? And so take advantage of this quick facts for NCLEX. If you do not have it and you are in Africa, there's no reason. Okay, because the book is there waiting for you. The book is there waiting for you in Africa. But exactly what I mean is that when you're able to pass NCLEX, you have a great, great, great foundation to work in the United States. Oh, another thing that we learned at the conference is the National Council of State Board of Nursing. The idea is through the NCLEX to promote patient safety and protection, right? And we know that this exam is built on safety principles. And because of the research, this exam is fair and comprehensive for entry-level nurses. The competency of NCLEX is for new nurses that's less than 12 months of experience. So you do not have to have experience to pass this test. Okay. I see you. Zambia has entered into the chat. Welcome, welcome, welcome. So at the conference, I want to share some of the insights because I think it's also important. I know these people, but I think it's also important that you see their faces too. This is the current directors of the NCBSN, and they're also over the NCLEX. So there's two directors for conference, for content of the exam, and then also for measurement and testing. And the insights that they shared are the following. This one right here. Will NCLEX be at home? That was one of the biggest questions. And so for all of you, the answer is not in the future of 2026 to 2029. So this next test plan that is coming out will cover 3 years. So we are for sure that there will be no NCLEX at home in the next 3 years. And boy, oh boy, was there a lot of questions and controversy about this NCLEX at home. And I can say from a personal perspective, we are not quite ready for NCLEX at home. We are not quite ready. And I know some people were really excited about it, and they really wanted to take advantage of taking the NCLEX from the comfort of their home. But you have to remember, if we are to take the NCLEX at home, then it needs to change quite a bit. It would need to be a totally different NCLEX at home, right? And I just wanted to just briefly get into just some of the technical requirements, because I believe that if you are a nurse from Africa, who I'm speaking to today, you need to take this test in a test center. You do not need to attempt to take this exam at home. All right, hear me now. Hear me very clearly. And for most of you, this isn't even a conversation that you should be having, because you're going to take the NCLEX this year, or you're preparing to take the NCLEX right now. So it doesn't even matter if whoever in the future will take it. We are encouraging you to take the NCLEX now. All right. But just some of the considerations from a technical standpoint. If you talk about taking the NCLEX at home, you have to understand you're going to have a certain type of computer, and it is going to have to be relatively new with a very fast and up-to-date operating system. You will not be able to take NCLEX at home with a computer that is from an organization. You will not be able to take NCLEX at home if you have a Chromebook, okay, or any other type of laptop or desktop with a limiting operating system. Another thing, your technology has to have a webcam, a microphone, and a single monitor. Also, I saw a lot of people say, well, I'll just go to a coffee shop or a library or a hotel room to take NCLEX at home. You actually cannot take the exam in any kind of public internet servers. So you would not be able to go to a hotel room. If you have kids at home, there's no way you can do this exam at home. And I'm a mother of 4. And at any moment, I know that my kids can come into this room and that would totally invalidate my exam. Right then, I would be automatically failed. If one of my children came in and asked me for a cup of water, my exam is failed. Okay? So think about all those things that NCLEX has to work out before they release this exam. Having multiple system checks, you would have to run those. And here's the thing. If you become, for any reason, disconnected from your exam, you would automatically fail the exam for any reason. If your system goes down or your Wi-Fi, I have trouble right here in the United States with my Wi-Fi. It is not stable. So those are the considerations for everyone. So if you're in Africa, let me give you a hint. You will either be taking your exam in South Africa or Nairobi. That's it. That is where I stand on it. Okay. So yes, Kenya or South Africa. That's it. All right. Because there's so many variables. There's so many variables that NCLEX still has to process and work out. And then for most of us, we don't want to have another reason to fail the NCLEX that has nothing to do with our intelligence. It's already challenging enough to pass this NCLEX. So you don't want to have another reason that you could fail that is not related to your knowledge. Okay. So we are not expecting at-home NCLEX in 2026. Okay. There is no guarantees. All right. We are expecting a test plan change. We are expecting a test plan change. And if you're just coming in, the WhatsApp number for our partners in Africa is +254 716 192 248. It's right on the ticker down on the bottom here. Okay. We are expecting a test plan change. They are changing it again. Now, they didn't give us the exact details of how they're changing it, but you guys know I'm a reader. And so today I will be telling you some of the exact ways they're changing it. All right. But the official test plan will come out in December. They always wait. They always tell us about it and then they release it in December. So right before Christmas, we should be seeing it. But anyways, for the RN and the PN, they're going to be doing 2 test plan changes. The overall format and structure is going to be the same. Okay. So that means that you're still dealing with a computer adaptive exam. Although I do believe that might be changing. All right. But I'm not going to go into that today. We're going to have a computer adaptive exam and the structure will be the same. So that is 85 to 150 questions. Okay. Yes. So the next gen, somebody's saying, oh my goodness, they just changed it to next gen. Now we have to wait for them to change it again. But listen to this. This is how we're going to see the changes. The categories and the percentages are not changed. Those are going to be the same. So we're still having the same 9 categories and the amount of each category is the same. What they're doing based off of the practice analysis is they're going to add one new activity statement. So an activity statement is sort of like a task or something new that they see nurses doing in the hospital environment, in the community environment that wasn't previously there. Okay. So there's going to be one new activity in management of care. There's going to be one new activity in pharmacological and parental therapies. There's going to be one new activity that nurses need to be knowledgeable about in physiological adaptation. Okay. They have not said what those activities are. But if you see how technology, if you see how digital pharmacy is infiltrating the American health systems, you can think that it's going to be something related to that. Let me go on to the PN changes. Those are the RN changes. So there's going to be 3 activities that RNs need to focus in on. Now, what about for the PNs? For the PNs, again, the structure of the test is the same. The categories of the practical nursing exam are the same. There's going to be 1 new activity in coordinated care. And coordinated care is like management of care for practical nurses. And then there's going to be 2 new activities. Well, 2 new statements in category 7 of the practical nurse exam, which is reduction of risk potential. And this is really big for practical nurses and registered nurses too, because we know that President Trump's administration has made some changes just legally and billing wise to our healthcare system. Is that right? With Medicare and Medicaid, they will not function in the same way in the hospitals here in the United States. So reduction of risk is huge. And when I talk about reduction of risk, this is what I mean, right? Anytime we talk about what is on the NCLEX, because what you're going to have to do is you're thinking about what will I actually see on the exam? Okay, what does the practice analysis tell us that's important? So the practice analysis tells us that in America, registered nurses and practical nurses do these things the least. What will likely be reduced on an NCLEX exam? That's going to be prenatal, postpartum care. Maternity in general is coming down. Most new nurses out there are not doing maternity care. Why is that? Why is that? That is because in America, the culture to get into maternity is very closed up. It's very closed up in terms of when a maternity nurse starts, and this is maybe how you guys are, you never want to leave. You don't want to leave. So in America, there's more med surg positions. There's more, different disciplines than there is maternity. Okay. So what are nurses doing the most of? Okay. Identifying clients, infection prevention, verifying medications to the correct patient. Verifying medications to the correct patient. And we just saw in the news here, there is this huge controversy because there was one nurse that was a practical nurse, and she gave 100 milligrams of morphine to a resident. She gave 20 times the dose that patient was ordered. Patient was ordered 5 milligrams. She misinterpreted that to 5 milliliters. And so this nurse, and this is very important for my nurses that are from Africa and who be coming over here. This nurse, in her hastiness, interpreted 5 milligrams and saw it as 5 milliliters. Now, in this nursing home, they only had 1 milliliter syringes. So she literally drew up 5 separate milliliters of morphine and gave one patient 5 milliliters, 5 separate syringes of morphine. Now, even in our least experienced mind, has anyone ever given more than 1 syringe of morphine to anybody? If she had just stopped at 1 syringe and said, I've never given 2 syringes of morphine to anyone, the patient would have only got 20 milligrams. Doctor ordered 5, you only would have got 20, but she kept going and she delivered that 100 milligrams of morphine to one patient. And ultimately, what do you think happened to that elderly patient who was getting morphine for the first time? Okay. What do you think happened? And so I had a conversation with an employer Friday. I took a meeting on Friday, And this new employer was telling me about opportunities for nurses and the jobs that they would be having at all these hospitals. And I'm excited. Okay, I'm so excited. And something that stopped me and paused me is this employer said, we're not sure if we want to use international nurses because we have seen that if they know something is wrong, there is a chance that they might not speak up. It has been seen that international nurses, even when they see a doctor has written a wrong order, they will go ahead and give that wrong order because they don't want to be confrontational to the doctor. So I'm asking today, do I have nurses on here that are okay with being confrontational, that are okay with telling a doctor this doesn't make sense, that are okay with verifying their medication orders with 2 nurses so that they don't have this problem? Because I said to that employer, I said, I don't know which international nurses that you're working with, but the ones that I work with have no problem with speaking up. And so I want to make sure, okay, I want to make sure that you understand that NCLEX is supposed to be a safety exam. However, you can still pass NCLEX and make big mistakes. Okay. And so that is why I absolutely see a need for this exam to change. This exam in its current format will be changed in the future, but we're talking about today. And this is why I want you to get into the mindset of passing this exam today, because the longer you wait to take and pass NCLEX, the more harder this exam will become. This is an event that just happened a few weeks ago. You absolutely know, everyone in NCLEX knows that that happened after this nurse passed their exam. All right, I can go on and on about this. Let me get back to my point, which is the way that this test plan is going to be changing in terms of the categories. So here's one of my changes. They haven't said it, but I'm publicly putting it out there. I'm giving a prediction. I gave a prediction that the NCLEX wasn't coming at home, and I was right. So I'm just going to keep my prophecy going. I do think that in light of everything that's happening in terms of Medicare and Medicaid in this country, the exam will move from infection control to infection prevention. And we literally have a category called safety and infection control. Okay, safety and infection control. I think that needs to change to infection prevention. Okay, I think it's going to have to. I like this comment. I want to read it. I worked in critical care for years under nurses. Most African nurses are scared to speak up, especially to white doctors. It's sad. Okay. And I love this comment because I think that this is somebody's experience. And that's why I'm making it known. Whoever has been afraid, y'all need to start speaking out. Because what we're seeing at the bedside is that doctors are using ChatGPT, they're using AI to help them write these orders, to help them make decisions. And so they might not necessarily know exactly what to do. But at the end of it, nurses are the defenders of the patient. Okay. So thank you for the comment here. I wanted to acknowledge it. So I think that the test plan will move from infection control to infection prevention. Now, what does that look like in terms of what will be on your exam? I gave you some examples here. Here's an old style question for the NCLEX of infection control. And I'm just going to read it to you. A client with suspected tuberculosis is admitted to the medical unit. Which action should the nurse take? So here we have a patient, we suspect that they're having TB. Which action should the nurse take? Here are the choices. Place a surgical mask on the patient. Initiate airborne precautions. Start an IV for medication administration. Notify the infection control nurse. So you have a patient, you think they have TB. What should you do first? Put a mask on the patient, initiate airborne precautions, start an IV, or notify the infection control nurse. Okay. I see some people saying 2. I see some people saying 1. Okay. Put the mask on the patient, initiate airborne precautions. Here's the correct answer. Boom. Initiate airborne precautions. TB, you guys know, is airborne. Okay. So that means that you have to isolate this patient, negative airflow room. You're trying to control the suspicion of tuberculosis. That's old. I'm not talking about that anymore. I'm talking about now, what will these questions sound like for the NCLEX? Here's a new question. Focuses on prevention. The nurse is teaching a group of new parents about infection prevention for their infants. Which statement indicates a need for further teaching? So we're talking about babies, infants. Whenever we talk about what needs further teaching, is basically asking you what statement is wrong. What statement is wrong? Here's the first statement. We'll wash our hands before handling the baby. Is that good or bad? We'll wash our hands before handling the baby. Good or bad? Seems good. Second one, we'll keep the baby away from visitors who have colds. Good. Good or bad? We'll keep the baby away from visitors that have colds. Okay. We will give the baby all recommended vaccines on schedule. That's cool. Giving the baby vaccines. About this one, we don't need to wash the baby's bottles if they look clean. Right? So this is a question that is changing. We're not talking about waiting to after the baby has an issue. We're looking to see how we can prevent it. So that means more education for RNs and PNs. Okay. Of course, so we don't need to wash the baby's bottles. That's bad. Okay. We're talking about prevention where? At home. At home. So if I did a side-by-side chart on the old way to look at infection questions and the new way, I would say this. Ruth said, we're coming over with the confrontational attitudes. All right. Okay. So when you talk about the task of the nurse, what nurses do, the old way is to contain and interrupt transmission for infection control. All right. It is. We're always looking at what's the isolation for MRSA? What's the isolation for C. diff? And that's that mentality like, okay, the patient already has it. How do we contain it? The new way is to prevent or focus on how do we prevent this patient from getting MRSA? How do we prevent this patient from getting cellulitis or getting infectious diarrhea, right? I like this comment. Angelina's back. She says, I'm officially a ReMar PN nurse. Yep, thank God. With him, all things are possible. And thank you for your V2 program. I passed NCLEX at 85 questions. I cried so much. And I love this testimonial because this is a time when NCLEX passing rates are going down. NCLEX passing rates are dropping. So let me tell you that we still are confident that you will pass. All right. We do it easier. We do it better. We do it guaranteed. Typical actions. And I know there's this, I see the comment where you can't prevent anything in healthcare. But I absolutely disagree. I think there are, and research would agree with me, there are protocol bundles that you can do, okay, that will allow a patient to have less risk. We know if a patient has an indwelling catheter, there are certain nursing activities that you do around that indwelling catheter so they don't get a UTI, right? We know if a patient has a central line, right? We're going to do COTI. We're going to do COTI if a patient has an indwelling catheter. We're going to do, CLASP if a patient has a central line, something like that, right? And so we have to focus on those things. So the old way, isolation precautions, personal protective equipment, sequencing, cohorting, who belongs in what room, those things are still important. But there's going to be a shift to hand hygiene, immunizations, safe bottle, breastfeeding, bottle feeding, how to clean bottles, and environmental cleaning. All right, that's the shift. Yeah, and this is what I'm saying. There were 1,600 educators that were at this conference with me, but literally there are 10,000 educators that were not there, that don't even know that this shift is happening. So one of the things that I love about our partnership is that I'm able to get this information through KenyanNurse immediately to my international nurses, so that they know immediately the types of things they will be seeing and encountering. And this is the benefit of having the technology, the ReMar V2 program, is that we are making these changes in real time. For example, also want to talk about the setting. So we're moving from a mostly inpatient to home and community, as well as inpatient for the new exam. Question stems. Right now, we're seeing which action should the nurse take first. After the test plan comes out, I'm expecting these types of questions. Which actions reduce the risk? It's a different approach. It's the front end. It's the front end approach. Okay. All right. Here's an example of one of the new questions, right? Here we go. A client arrives, right, exactly. A client arrives at urgent care with cough, fever, and night sweats. Which action should the nurse take first to reduce exposure to others? Number 1, obtain a sputum sample in the ambulance. 2, place a surgical mask on the client and then move them to a private room. 3, don an N95 and begin chest assessment. And then 4, place the client in a private room. So this one is kind of like the same question, but it's more granular. It's more granular. Okay. And it is actually asking you to consider others here, but it's a step by step. Which one would you do first? I see the answers on the screen. Second one is correct. Put a surgical mask on this patient, put them in a private room. 2, I see a lot of 2s. You were on the right track. Yes, mask and then isolate. Okay, so mask and then separate. There you go. All right. So if you have my V2 Q bank, we already started putting these questions in that Q bank, and we changed the name of our category to safety and infection prevention and control, because I think that's what they're going to change it to. They're going to still have to keep the control there, but they're going to have to add prevention. So check out some questions like that in the V2 and get started, because one of the ways that you can pass NCLEX is to be prepared for what you're going to see on the exam. And we're not going to be on this live long. One more thing that I want to talk about in terms of changes is something that I know for sure is going to be on the exam, because they talked about it. And that is, of course, check out the questions. That is the new question type where you have case studies now involving multiple patients. This is the one right here that literally blew me away, because we know traditionally case studies just have one patient and you have 6 questions about one patient. Okay. It was already difficult to learn how to write those questions because you do have to follow the clinical judgment measurement model. But now you are to use that same model. Plus, they talked about using lassitors to make decisions for 2 patients or 3 patients at one time. I believe 2, though. So let me show you the ones that we wrote already. I spent the weekend writing case studies that have 2 patients in them. So what I'm about to show you are what that looks like. Okay. So for example, and I know it may be hard to see, the intention is not that you do this question, because like I said, they're in the V2. The intention is for you to be able to recognize what the formatting looks like. Okay. And recognize what your goal is when you get a case study and there's 2 questions. And absolutely, yes, this is a harder test. Even though they say the difficulty level has not changed, well, it just makes sense that the exam is going to be more complicated if now I'm juggling 2 patients in a case study. So that's why I'm telling you guys, take this test now if you can. Don't wait till next year. Don't wait till the year after, because this is something that they added in the middle of the cycle, right? And so they're able to do this. They're able to add these new question types, and more are coming, okay? They're able to do this because all they say is, I have not changed the difficulty level. Okay. So yes, this question has been affected. This is a new question type. It's already been affected. Somebody said, yes, you had 3 case studies like this, where you have multiple patients. So here it is. Let me just make it big. So essentially, this is one for just 2, because I want you to gradually get into this. And then I can go up to 3 patients, and I can go up to 4 patients. But this is just an example with 2 patients, and you have to read their information, right? Patient A is a male, and they're 68 years old, and they have some things going on. And then patient B, female, 78 years old, she has some things going on. And so you're to read their nurse's notes, you're to read their medications. This is what the medications can look like. You have a list of medications, right? And I love when people come in here, verify me in real time. Is this what you're seeing on NCLEX? You have medications, they have separate medications. They may even have parameters for their medication. So for example, one of the patients, Mr. Garcia, his medication says he is getting a medication, rifampin, 600 milligrams PO, and he's getting that's going to start after his baseline liver function test. So you need to understand, has his liver function test been done before I'm going to say that I'm going to give this medication, right? Our other patient, her medications are only given if she has pain under a certain level or over a certain level, right? So all of these new changes to the NCLEX are to prevent what happened to that poor patient from happening. Okay? Because what they found out is, okay, yes, nurses can do case studies. Nurses can do case studies with just 1 patient and they can manage it. But if you're an LPN and you're going into a nursing home situation like that nurse was, you may have 14 patients to care for. All right. You may be overwhelmed immediately. And yes, English is not your first language. This is a lot of stuff to sit through, read, and figure out what is important. Okay. All right. So patient has medications. Also, patient has vital signs. Check it out. What are the vital signs telling you that you need to be mindful of this patient? One of our patients has 100.1 temperature right now. Is that okay? Is that consistent with the symptoms or the diagnosis? The other patient has only 15 milliliters of urine in the last hour. What's going on with that patient? Based off what you know, the question is, who is the priority? Who do you go to? Okay. So these are the types of changes that you want to be in line for. All right. And so I'm really just happy that our educators are on it. We did a training on it so far. And let me see if I can, this is giving me, our educators are on it. We did a training on it, and we have these questions in the V2. We're going to be talking more and more about it. But yes, this is what you are expecting. And is this public knowledge? No, not really. Because the conference was a closed conference. So the idea is that you are taking the information that you learned at the conference and you are changing the way that you're teaching students. And so it's very unfortunate that many nurses, many of African nurses, many of international nurses who are going to be taking NCLEX, and they're not with this program, they're not they're not listening to me and Paul, they're going to go in there and be totally blindsided that this is on the exam. And that's the problem that we are trying to solve for you. Okay? Why was it closed? It was closed because NCLEX is a business. You guys have to understand, this is a business. And so the organization has to protect their integrity. They have to protect who has access to their things. And there's certain levels for certain people. Okay. So I want to say that. Okay. All right, everyone. I just wanted to come on here and I wanted to just talk about how the exam is going to be different so you can anticipate these changes. But at the end of the day, like I said, the longer you wait to take NCLEX, the harder of an NCLEX it will be. The harder of an NCLEX it will be for you. So I want to invite Paul back on to discuss maybe his thoughts, his reflections, his encouragement. Okay, his encouragement to you who are in the African diaspora that are, planning to come over. So welcome, Paul.
Thank you so much, Prof. And it's true, whenever changes happen, they
Mm-hmm.
do not easily get communicated to the people who need to hear those changes on
Yes.
time. Especially those nurses who've always come from Africa have been disadvantaged in terms of access to those changes,
Yep.
access to the updates. Unfortunately, with our partnership, we are able to relay those information, updates, and anything in relation to that as quick as possible. And that's why we thought of having this webinar just to update each and every nurse who is preparing with us, who is planning also to prepare with us. And truly speaking, I'm a witness of actually changes in the structures of the exam. For
Oh.
example, when we speak about, I hope I'm clear, when we speak about changes, when the nurses were coming to UK, changes were happening every now and then. And as they were happening, they were making the process harder, they were making the process expensive, they are making the process more confusing.
Mm-hmm.
So the same happens if you are outside there and you do wait for actually these changes to come in effect, it means you're going to be disadvantaged. You rather sit for an exam and the structure that you're used to as we speak. So we've seen the new changes are going to come in from 2026 to 2029. And now, from now, that is September up to December, we have like 4 months, which you can capitalize on them, be able to sit for this exam by December, and it's possible because nurses are doing it within 3 months, 4 months, they are able to focus. And one thing I normally tell people complain that US process is expensive, but the most expensive thing in any person's life is time. That is why in Africa, we measure our distance with kilometers. In America, distance is measured in time. I'm 5 minutes away. In Africa, I'll say I'm actually 5 kilometers away. And that actually obscure many of us to understand that what is important is not the distance. What is important is the time.
Yeah.
So this time that you spend 5 years processing is so costly.
Mm-hmm.
You rather drop everything, focus on one thing, that is NCLEX. Within 3 months, you've smashed it and you put it aside and you do other things in life. If
Exactly.
not, you're going to process with other agencies, which are even renowned here and there, but you're going to stop your life for 5 years. Imagine having to stop your life for 5 years, having to stop your life for 3 years. It's really expensive. So don't wait for these changes to come in.
Mm-hmm.
Don't wait for you to do this process in more than 6 months. You are spending much because you are taking more time. So, with together with Professor Regina, we are committed, we are consistent, we are determined to ensure that you have access to this technology, you have access to this information, you have access to these updates, you have access to the best ever training, and that is the ReMar NCLEX training by Professor Regina. In doing so, you able to actually have added advantage, unlike those who are not training with us, unlike those ones who have never heard about us, but you have heard about us. It's your time. And for those of you who are about to make the decision, for those of you about to start, for those of you who want to actually sit for the NCLEX with current structure, sit for the current uh, test plan, not wait for the upcoming test plan. This is your time. We do prepare nurses for NCLEX RN, that is for those who are preparing to be registered nurses in the US. And you can use the same NCLEX. Imagine to go to Canada, to go to Australia. It's quite applicable across those countries. Then we also support and train those nurses who are, or we call them practical nurses. In Kenya, we still call them nurses because they are registered as nurses, but at the certificate level, they are to do this exam we call NCLEX for practical nurses, NCLEX PN. So we prepare both NCLEX RN and NCLEX PN for the NCLEX exam. If you are there and you want to sit for this exam that is still existing now, no changes yet, this is your time. Come to us and we'll be able to actually ensure that you are able to sit for the current exam. So if you are in any country, remember, we are supporting all nurses from Africa, whether you are working in Dubai, Qatar, Saudi Arabia, whether you're working in UK, German, Ireland, Malta, or you're working in your home country, we are able to reach out to you. We have books apart from the training, and we ensure that all these books are dispatched to you. How? Why? Because we want you to have access. How? We do work with DHL to help us disseminate all these resources in any African country, including those countries that are outside Africa. So if you come to us, we're going to ensure you have the training. We're going to ensure that actually you can access the resources, the books, you can access the technology, you can access the culture, because you are being trained by an American, not a Kenyan, not a Ghanaian, but an American. It means you're naturally going to acquire that culture, you're naturally going to acquire the technology, you're naturally going to actually be able to pass the exam, because you must and you will pass the NCLEX exam whenever you're training with Professor Regina. So wherever you are, we are able to send to you books, and we have slots. Professor Zina normally issues us slots as per month. For this month, actually, we're looking forward to have 150 nurses who are preparing to be registered nurses who are going to sit for NCLEX RN exam. We have 150 slots, and we are taking 150 nurses in this period. However, you do understand that this is as per KenyanNurse, but Professor Zina has extended her training across various nursing schools. So if you know your school was mentioned somewhere and you're comfortable actually being under their care, I wish to request you to call that school where you train and tell them, I want to join NCLEX. And you shall be able to be admitted. Also, we do have NCLEX for practical nurses, 75 slots for you guys. If you wish to join us, we wish to welcome you. And if you know a school that was listed, and we're going to list them afresh, and you wish to train with your home school, we are able to facilitate that to happen. And those schools that have not joined us, please, please, please reach out to us so that we can work together. We bring this technology, we bring the culture to your home school, to your school, so that you can support these nurses immediately they are done with their final exam in your school. They're able to start their American journey straight away, and they will be doing that from the comfort of your school, from the comfort of their home, with your support. In doing so, we'll be able to empower as many nurses as possible. So as a principal, as a nurse tutor, as a lecturer in any university, and you are passionate about the nursing profession, you want to be part of this consortium, you want to join the wave, you want to join the next frontiers of the nursing profession, reach out to us through customer service at kenyannurse.com, or you can email us at info@kenyannurse.com, and we'll be able to actually give a chance to demonstrate to you how the resources can be helpful to your institution. And for a nurse who is looking forward to train with us for joining the NCLEX RN program that is going to commence as from tomorrow, we welcome you. You can WhatsApp us on +254 716 192 248. And the number is just going across the screen, and you'll be able to pick it up. If you can take a screenshot, I also appreciate, because that will easily enable you to access that number as quick as possible after today's session. And how do you make payment to us? Yes, you are able to make payment whether you come from Ghana, whether you come from Cameroon, whether you are in Dubai, whether you're in Saudi Arabia, whichever country you are in, we are now able to receive payment from you. If you are able to scan that code, or you can take a screenshot of this screen, you'll be able actually to make the payment. So you just scan that code. Once you scan that code, it takes you to the payment point where you choose the second option, pay by card. Don't pay by bank, pay by card. Once you do so, you WhatsApp now the payment. Once you've done the payment, you WhatsApp that payment message or payment confirmation to +254 716 192 248. If you can help me by taking a screenshot of this screen, it will really help you because you'll be able to access it and be able to use it to make the payment, especially those nurses who come from outside Kenya and Uganda. For those who are in Kenya or Uganda, here's the payment. For those ones in Uganda, if you are in Uganda, if you are outside Uganda, that is the method. You can also send us an email to customer service at KenyanNurse.com, and we shall be able to actually give you the process on when you start. If you do so now, I'll be able to respond to you and we'll be able to start your journey today so that you don't wait to sit for the next upcoming test plan structure. You rather use the existing one because maybe you've prepared with it. You are able to pass this exam without struggling. So that is for those who are outside Uganda, outside Kenya. What about those who are in Uganda or in Kenya? Let's go to the next slide. So those in Uganda, you can pay to KenyanNurse through what we call MTN mobile money, and you just need to enter *165#. Then you choose option 6, which is the financials services. And then you choose option 1, that is the bank deposit. Then you choose option 1, which is Centenary Bank, which you enter our account number, that is 3100101721, and you confirm everything as per your security details, and you'll be able to make the payment. And once you've made the payment, you are able to WhatsApp that payment confirmation to our +254 716 192 248, the number that is going across the screen. And it will be better if you take a screenshot because you can always confirm. You can always be able to read back that number. Remember, people outside there, some masquerading to be our staff. Don't be con, always confirm. Always reach out to us, confirm, confirm, confirm. For those in Kenya, we only receive our payment through one method, that is through our pay bill, and our pay bill number is 4084929, and you use your official name. Please, when you are entering the account name, the name that will appear after you've made the payment is KenyanNurse Consultant Limited, and that will tell you that you've paid to the right merchandise, that is, you pay to the right company. And once you do so, ensure you reach out to us through the number that is going across the screen, that is +254 716 2192248, and we shall be able to actually assist you, help you, guide you as quick as possible. I wish to reiterate, we have a lot of people outside there who are masquerading and scavenging on nurses. I need you to be careful. Don't make any money to any other method that we have not communicated here. And if you are ready to make the payment, you can go ahead also to make a confirmation. Reach out to us, confirm, then you make the payment, because we want you to be safe. Because a safe nurse will be able to provide that safe care to the patient whenever you arrive to the US. So that safety starts with you and starts immediately you actually become part of us. You ensure you are safe with everything, with your money, with your process, with your everything, so that when you arrive in the US, you're also going to be safe every aspect of your care. And in doing so, you're not going to find yourself in trouble. You're not going to actually struggle adjusting, struggle actually going through that change, transition or not. And Professor Dina will always be available to give us more update on how we can be safe, on how we can actually ensure that we go through that transition without struggling. And we also have what we call KenyanNurse Family. It's a group of nurses. We are together. We are able to share updates. Immediately they appear. We are there immediately sharing. We share success stories. We are excited about our steps, our process. If you are happy to join us, we wish to welcome you. You can scan that QR code and you'll be able to identify the WhatsApp group to join. And once you join, please, I need you to be cautious because people outside there scavenging. Just join and we shall be able to guide you to share stories, success stories, be excited about the process and walk together the journey as a family of nurses until we are actually able to achieve our dream. So take a screenshot and be able to use that screenshot whenever you need to confirm anything, whenever you need to ask anything. You'll be able actually to identify the QR code, the number, the email, and with that, you'll never be scammed. You'll always be safe. So that is something that I need to encourage each and everyone. Today, right now is your time. There is no like tomorrow, because the more you wait, the more it becomes complicated. The
Mm-hmm.
more you wait, the more it becomes advanced. Now AI is coming in. We don't know what's going to happen now.
I'm
As
telling you.
much as there is some policies that are changing, which are interfering also with the exam structure, remember AI is also on the way and infiltrating the healthcare sector. Soon things might be different. So
Very different.
don't wait until things are different. Sit for this structured exam that you do understand, that you've reversed for some time. So if
Yeah.
you've been training, don't postpone, because you'll have to restart afresh the training.
Yes, it's true. It's true.
So before I take more time, I want to bring back Professor Gina so that she can tell you why, how you can pass this NCLEX and become a USRN so that you join her in the US. Prof, it's always a pleasure
Thank you, Paul.
co-hosting you this session, and it's a blessing to so many nurses having you to also share your updates, share your inspiration, break down all this information for our nurses to be able to understand and for also them to become safe. And it's also a privilege for us to work with you. We look forward to extending the same services to nurses across Africa. If you're a nurse in any African country, you can shout your name there. And of course, we shall plan to come to close to where you are in the next coming few visits that we are going to make. Be free, be proud of your country. Type your country there, and Professor Gina is
Mhm.
going to read out. Thank you so much, and it's your time, Prof.
Thank you, Paul. And I hope you got the picture. NCLEX is not waiting to change, and neither should you. You should be on this like the most important part of the journey because it's really the easiest and it could be the fastest. So get that USRN, take the test that's current. Because, like Paul said, and I think it's just well known that AI is taking over this thing. And every time they change the NCLEX, they don't make it easier, they make it more challenging, more aggressive. And so with international nurses, the more complicated the exam can be, the further along it puts you from your journey to becoming a USRN. So no matter where you are, what we're trying to do is we're trying to take you from that country to Nairobi to New York, okay, to make sure that you're here. And so our partnership in KenyanNurse, it makes so much sense. They're right there in Nairobi. We're right there where the test center is. If you need help with your travel, if you need help with your paperwork, if you need help with your hotel, what we're saying is that all bases are covered with this pathway. So do what makes sense, okay? Because what usually makes sense is the easiest for you. And we're looking forward to being a part of your legacy. This is a small part of your journey. When you come to the United States, you have the amazing opportunity to grow not only professionally, but personally as well. So it was an absolute pleasure to be here with you today. I hope that we accomplished our mission, which is even if one person decides to make that call, even if one person decides to send that email, get the information to take the next steps, then it was worth it. All right. Because we know that knowledge is power, and getting your power and your time is worth more than anything. So thank you, Paul. I like this comment here. Paul, you're a great inspiration to many, from Kenya to the world, from Kenya to the world. And it's my pleasure to know to know Paul and the great work he's doing. So I'll leave you with this. I say it all the time, but I absolutely believe it. You can, I say this, you will, and you must pass NCLEX. Isn't that right, Paul?
That is true. You will, and you can, and you must always pass NCLEX, especially when you are in the hands of Professor Regina in the support of KenyanNurse. And
Yes.
we look forward to have more USRN.
All right. Bye-bye, everyone. Have a good day. Have a good night.
Bye to everyone.